What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering top questions that patient asked the X-ray tech. So some of the most common questions I would say that we would get is, why do you step out? Like when I get X-rayed, how dangerous is it for me to get X-rays? I'm pregnant. Will this affect my babies? I thought you said to turn left. Or the most common one, we're like, okay, so which foot's hurting? He's like, well, this one's hurting, but this one's hurting also. And then we're like, but which one's hurting? Well, like, what brought you in today? It was my chest. And you're like, well, why you tell us about your feet? It could just be random stuff that they'll tell us. Other questions that will involve is they know someone at the work at the hospital, or other veteran techs who've already been retired, give us the whole spiel of like what it's like. Can I look at the picture? Can I take a picture of the picture? There's several things that you will have to, go through as you are working in the X-ray, both with the patients, both with the nurses. You'll have certain patients that will come in a lot. You'll see them, you'll recognize the name, and sometimes they will talk a lot. They'll ask a lot of questions. So usually you try to, be very professional, just give them the best example. Occasionally you get asked how X-rays work, which, we know with the whole radiation, the cathode, anode, and the whole thing, like the whole spiel. There was one time I did have a physicist, like the Sheldon dude, and he explained to me literally verbatim something I've read in my X-ray tech book, and I was like, yeah, he's right. So occasionally you'll have like smart people that will they'll know their stuff. But usually it's the same basic gist as far as like simple questions. You're like, how long does it take to read? Like how can I get a copy of it? How the report? Like just basically just like of radiation, both like their care and the other aspects of X-ray. It's pretty basic questions. I don't think there's been anything that you can't just like give them a simple answer, or kind of, when they ask you, oh, is it broken? You're just like, give them a little spiel of like, you just take the X-rays, you'll send them off, and then, the doctor will come look at it, kind of stuff like that. Yeah, it's been your boy Miguel. See you on the next one.